usually we do this when we do cataract surgery when the patient is older. Although I have some patients I did it when they're younger, just closing the coloboma without and leave the lens, leave the crystalline lens. But those are usually, we can suture those typically, if they're congenital. If it's acquired, if it's traumatic, depends on the size, we may have to do a prosthesis in that example, you know. But that's my philosophy. I have many examples where we suture the coloboma nicely, and it creates a nice, you know, round pupil. Thank you. So Azerbaijan Medical University is in Baku too?
Yes. Dr. Samira Husseini from National Ophthalmology Center from here. Very nice to see you here. You are welcome. And we thank you for your very incredible, interesting presentation. My question regarding about the future of your field, about applying the artificial intelligence, but robotic surgery. What, do you have any research ideas applying the some artificial intelligent AI tactics?
Okay, great question.
Yes.
I'm actually going to ask Khizr, because come up here. He is ophthalmologist, but very much into technology. So you want to say a few words about artificial intelligence and ophthalmology? Come on up. You don't mind because he's smarter than me on something. No. Because he has developed a lot of research in visual performance. Also doing a lot of work with artificial intelligence and big data, for example. So maybe you can say a few thoughts.
Yeah.
2 minutes or less.
Well, this was atypical, but thank you. Assalamualaikum. It's a pleasure to be here. Thank you so much for having me. In terms of your question, in terms of the field of ophthalmology and where it's going with artificial intelligence, I think now is a great opportunity, as Ike has mentioned, to set up your research, especially with a lot of the young folks here. When you think about it, you're already using some of these tools. Who in the audience has used ChatGPT or DeepSeek or Gemini? Like, raise your hand. You can raise it higher. Like, be proud. I mean, okay, good. So when you kind of think about it, you're already starting to use some of this technology, and it's really about the creativeness. Is like, how do you use it in terms of research? Well, there's a few different ways. One, you can kind of optimize as you're kind of, going to what Ike mentioned about, making sure your study designs are set in a way where when you're capturing this data, and since you have a kind of hub and spoke model with a lot of clinics in Czechia and two other places that I can't remember, you can start centralizing some of this data. And then that can kind of allow you to catch up quicker in terms of some of the research interests that you guys have. Where things are going, I think a lot has to do with visual function assessments. We're starting to go more in terms of consumer technology. There's a lot of, as you can see, a lot of people are using virtual reality in terms of visual field testing, visual field testing, and other areas where we can start getting a lot more data at scale around how people are actually perceiving, and then can kind of identify how to use that data to look at diseases very much upstream. So how do you identify glaucoma through everyday devices? This is some of the work that we're doing at Stanford, is really kind of identifying how to use everyday devices and capture information that can better inform us. And just to let you know, there's a lot of big tech companies in the space kind of looking at that. So you guys have a lot of advantages here, because I mean, this is probably one of the nicest hospital, like eye centers I've been to. So mashallah, it's very nice. You're up to date on all the different technologies. So when you think about it, in a national system, you can actually capture a lot of data. You can work with industry. You're already working with Zeiss, and you're working with all these different groups. I would encourage you to start working with some of the technology companies and embrace some of the new technologies here, where you can capture this data and combine it. So definitely in terms of research interest for those that are in training, Ike's doing a lot of great work in this space too. We're here to collaborate. So, thanks for having me, and thanks for putting me on the spot.
Yeah, thank you. Yeah, I think it's a great question. I think it's a lot of unknown to me. Obviously, we're excited about artificial intelligence. I think that Some of it is a bit of hype, I think. I'm not saying not to follow it, but I think, you know, obviously the ability to use big data and help us with diagnostics is going to be helpful. IOL calculations, we already use it. Glaucoma progression, glaucoma assessment is going to be important. All of this, I think, will help, in the end of the day, to help to individualize care. Like I do MIGS surgeries. I may do a MIGS surgery, I may do a trabeculectomy, but I don't know what is the best for you, you know. And using big data and artificial intelligence will help us to guide us. I believe artificial intelligence, I believe genetic testing, polygenic risk score, for example, will help us to guide us how aggressive to do surgery, what surgery to do, how to do post-operative. That's going to help us as clinicians. And that is a combination of course, you know, being able to understand the right biomarkers to measure with artificial intelligence and big data, and of course use genetic, you know, predisposition tools to do that. That's where I feel there's a lot of interest in that. I think we use artificial intelligence in many ways. For example, we now use artificial intelligence to grade surgeons. We have work we do where we can actually see how you're progressing as a resident, what level you are for surgeon as far as your level of training. So it's incredible to be used for all these purposes, to be able to smooth workflow and to help to individualize, personalized medicine. That's what our ultimate goal with personalized medicine. I think this is going to help us for that, and hopefully it won't replace us. Never will, of course, but I think it's exciting, but also a bit of an unknown and a bit of a question mark for me a little bit. You know, so far the data we see, it's really cool. You can look at a fundus, and you can tell whether it's male or female. You look at a fundus of diabetic retinopathy. You look at a glaucoma disc, is glaucoma or not. I mean, we can do that. It makes it more efficient, and it double checks our work, of course. But we still need our own assessment right now. But the future is very bright, of course. That's my thought. But thank you.
The last question.
Last question.
I suppose last maybe someone was
I mean, you
last.
made a long list of questions. I'm impressed. She gets a reward.
I was just want to catch a lot of information from both of you actually. So you mentioned ChatGPT, DeepSeek, artificial intelligence, and you mentioned to use it in research. The question, as you understand, English is not our native language, and for publication we need native language English. So before we use some helping translator programs, we send our articles for AGE, etc. They translate to native English language, and we did publications. The question, can we use now ChatGPT or DeepSeek, for example, for literature, for big background, beginner, or it will be as plagiarism if I will use ChatGPT as rewrite the words, sentences, etc., or you have no idea?
Well, I can tell you, we look at this on the editorial board, and I sit on the editorial board for Ophthalmology, which is one of the top journals in ophthalmology. And so, you know, right now, you know, AI should not be used to write a paper. Period. To do a literature search is fine. You know, I mean, PubMed in some ways, if you do PubMed research, in some ways it's using some form of artificial intelligence, right? So, doing a literature search is no problem. But you know, right now.
I'm in the right at the end discussion of
Yes.
Yeah. Well, no. I mean, I agree with Ike. I think part of it is you have to understand the limitations. So there's a lot of bias in a lot of these large language models, especially in regards to like our subspecialties and our like subject matter expertise. So really, if you know, a lot of it when you're prompting and you're asking questions to it, and you know, to get an answer, think of it as any other tool. There's certain limitations to it, and you at the end know what's best. So if you try using it, and you try and take that information, you know, you want to use it for research and you want to create a publication, there might be a lot of false information in that you don't even realize.
I mean just rewriting the sentences.
Yeah, so even in rewriting the sentences, it might take it, because you know, it's not going to be as familiar in some ways in terms of the translation part, so the sentiment might be off in that sense. So there are aggregators. There's ones like Poe is one. What's another one? It's called Gamma. These are ones where they take all of the ones that are out there. So they'll take like Claude and DeepSeek and you know, just all of them. And so you're putting one prompt in, and you can see how it might be different. So if it can be different across all of these, then you have, you know, you can kind of see the biases, and you have to be very careful. We're still very early And I think that a lot of it is knowing that it's a tool, it's an imprecise tool that now a lot of people have access to. And, but you can use it to make your more proactivity in terms of like, what question am I asking? How do I set up my framework? Those types of things you can do, but I wouldn't, as Ike said, a lot of the thought and originality comes from a human.
And I would just say that, when you submit a manuscript to our journal, we run it through a plagiarism check. We use AI for that, actually, And if you're using AI to do the manuscript, there's a risk that you're going to have some, plagiarism risk here as far as doing that. So that's another problem you have to run into. So, I think I would say that it's interesting to trial it, but I would really be careful relying on that. Maybe you can use it as a basis for your work, and then you can adjust it. I realize the challenge. We're sympathetic to non-English researchers, Ideally, you have a collaborator who can help with that, as far as help writing the paper. But maybe things will change. Maybe in 10 years it'll be different. Who knows? But right now, we're very sensitive to this. So if there's any kind of hint of using AI, then the editors will be very suspicious on that, So right now, maybe it'll change in the future.
Thank you for this.
Yeah. No, thank you.
We easily shifted from the artist future into writing the paper.
Yeah. Already it is.
Already. Any questions?
But maybe just to finish, say a few words just to finish. And by the way, are you okay to take a picture together before? Yes. Okay.
Before,
Oh, okay.
I would like to express our sincere gratitude for your outstanding lecture today. And your presentation was really, truly invaluable source of knowledge for all of us. And we're honored to present to you the certificate or cube.
Wow. Very nice.
This is a small symbol of our deep respect and admiration for your job to advancing ophthalmology.
Thank you. Thank you very much. It's very nice.
And this is honor member of Azerbaijan Society.
Oh my gosh, I'm so touched, really.
Ophthalmological
Wow,
Society.
wow, what an honor, what an honor. Thank you so much. Can we get a picture together like this, maybe?
Yeah.
Thank you again.
Thank you very much.
And continue our profession.
Thank you. Let me say just a few words. Thank you so much. Again, this is a very special, special memento of being here, and I'll make sure I keep this on my desk. So I really appreciate that. But I really, again, thank you for making this visit a very special one. And I don't deserve the kindness. Honestly, I'm like everybody else, really. No, I'm like everybody else, simple guy. Anything that's good comes from above, and I'm very lucky to do what we do. I'm very impressed with what you all do. I mean, thank you, Dr. Emil, for giving me a beautiful tour. And what you do is amazing. I know from what you're telling me, you're making a very significant difference. Maybe I just talk more and I post more, but that doesn't mean I'm any different than any of you, honestly. So I'm very humbled to be here. Thank you so much. And again, you're always invited to connect online or come to Canada and visit. I don't think we have had Azerbaijan visitor yet. So you're welcome to visit. To me though, you gotta visit to me. No, we have Azerbaijan in Canada, yes, of course. But in my room, you're welcome to come you have to come to my room anytime. But I'm glad you had a good, I know you had a good experience, I know. With Peter, right? Yes, exactly. So, but thank you again. Again, I feel I can spend the whole day with you, of course, and even more. But thank you again for your kindness. I really appreciate this. Thank you. Thank you for inviting me. I came because a young ophthalmologist was messaging me, come to visit, and I'm glad it happened. So thank you very much.
Thank you so much.
Thank you. Thank you. Let's take a picture together.